Hello, I'm Dr. Wickham Simons. I'm an obesity medicine specialist from the Triangle region of North Carolina, and this is Obesity Medicine Perspective. Last week I was talking about combination drug therapy, and I talked about the combination of phentermine and topiramate. Now look, that's an effective combination, and the phentermine-topiramate combination causes people to lose more weight than phentermine alone, and it is more effective in weight maintenance than either drug alone. So that combination is important. Combination drug therapy for the treatment of obesity, for the management of obesity once you've lost weight, this is an important concept. And if you are taking one drug like phentermine and it is not enough and you're having a hard time, there are other options available. So I want to talk about another drug that I commonly use and that I've talked about before, and that drug is metformin. Metformin was classically used for pre-diabetics to prevent them from becoming diabetics. And it doesn't act by lowering your blood sugar. Metformin acts by lowering your insulin level. And if you know anything about me, you know I talk about this insulin level a lot. Insulin's your fat storage hormone. If you eat a lot of carbs, you have a high insulin level to control your blood sugar, you're always storing fat. Metformin lowers your insulin level. The reason you can't take metformin is if you have renal failure. Most patients of mine don't. The only real side effect you get from this drug for the most part is GI upset if you were to take it on an empty stomach, so it's the kind of drug that you actually take with food versus on an empty stomach. I use a lot of it in combination with phentermine. I use a lot of it in combination with the topiramate I talked about. So you'll find some of my patients are on phentermine, topiramate, and metformin. And after a few weeks of taking that metformin, it really begins to reduce your appetite and your cravings for carbohydrates of all kinds, whether they're starches, whether they're breads, and whether they're sugary things. So that's something that you could take advantage of. I've had a whole lot of home run patients on that combination, that triple drug combination in this case, that have lost a ton of weight, and it's something that's available to you, and it's cheap, it's readily available, and it's something that most of my patients are a candidate for if when you talk to one of our providers, you feel like you need something like that. So you let us know. Don't get frustrated if your current drug regimen doesn't seem to be working as well as you would like. Sit down, meet with us, and we'll try to come up with something that works for you. So until we talk the next time, I'll give you the tools, you give me the effort, and together we overcome obesity.